Hey everyone, I'm Dr. Ellie and I'm here with my podcast, I Heal Kids. And if you do not know me, I am a holistic pediatrician in Asheville, North Carolina. So if you are in or around Asheville, North Carolina, and you need a holistic pediatrician that specializes in integrative functional medicine and optimizing your child's genetics in the container of mind, body, and spirit, then reach out to me. Again, my practice is Middle Path Integrative Pediatrics. I also, just so you know, see people ages 2 to 102 for functional medicine. So if you need any of that, definitely reach out as well. And if you don't know what that is, check out my other pods because I have a lot on that too. So let's talk a little bit more about supplement support. So what is the difference between supplements and herbs or botanicals? Because that's a huge question. Supplements refers to dietary supplements. So stuff that you would eat in your diet under normal circumstances, like should we have this amazing, diverse, organic, beautiful, glyphosate-free diet that most of us do not have, we would be getting that in our food. So that's why it's called a dietary supplement. It's supplementing the food. That is different than an herb or a botanical, which is like a plant medicine. That is not something that you would generally be randomly eating. It's just like something that you would take in that circumstance. So there can be some overlap, like chamomile. I don't know how many of us generally eat chamomile unless we're drinking tea, but usually that's more of we consider that an herb, not really like a dietary supplement. Okay, so what are some of the basics? Vitamin D3. All right. 100%, if you are in my practice, I am going to recommend to you that we get some D3 into your child. Now, there's probably a few exceptions. If you have a kid who's drinking a boatload of formula and they're a young infant, they're probably getting enough from that formula depending on how many ounces they're drinking in a day. That said, if you're breastfeeding, I'm definitely going to recommend that either your baby or you are taking vitamin D so that we can support immune regulation in your baby. And most kids honestly do not get enough vitamin D from sunlight. I get that question a lot for older kids. Are they just getting enough? Probably not. I mean, we spend so much time inside nowadays with school and everything else. There may be the rare child that is, but honestly, the number of times that I test vitamin D, it's always low unless it's somebody that's supplementing. So I'm trying to think if that's true, if there's ever been an exception. There's probably been one or two, let's be honest. I just can't remember. But in general, that's the trend that I see. So we definitely need vitamin D. So for infants, it's going to be 400 IU a day, 0 to 12 months and up, 600, older kids, 1,000, and then it goes up from there. So check in about that. Vitamin C, this is a great antioxidant. So antioxidants, what the heck is that? So oxidation, let's talk about that. So basically oxidation is if you had a machine gun shooting at a wall and that wall was your body cells and they're getting destroyed, that's oxidation. Okay. Antioxidation is the dude that comes along and puts up a shield in front of that machine gun fire. Okay. That's kind of a violent example. Let me try and think of a better one in future. All right. So that is antioxidants. There's so much more I can say about that and attacking the mitochondria, the DNA, the cells, and all of this. But then we'd have to look at, really boring biochemical charts. And who wants to see that except for me? Nobody. Get some vitamin C into your kids. It's a great antioxidant. That is the bottom line. For young infants, we're going to do a lot of citrus foods. You want to do those anyway with older kids as well. But if they're really not getting a lot in their diet, we are going to want to do some vitamin C. You're going to want to give it to them up until bowel tolerance. So what the heck does that mean? That means that vitamin C can upset their tummies and, give them a little bit of diarrhea if you do too much. So just go slow with how much you're giving them. And most of the bottles will have the correct amount. If you're not sure, definitely reach out and ask. Zinc. Zinc is essential for fighting most viruses. Research does show that zinc can shorten the length of cold if it is started early on. You guys, if your child has had a cold for 12 days, starting zinc is probably not going to help. But if you start it really early on, it can. That said, this isn't one that I would recommend just taking on the daily because zinc is like a seesaw with copper. And if your copper gets too low because you've taken too much zinc chronically for months and months and months, that is going to cause a boatload of other problems. So When you're sick, take extra zinc, otherwise just get it from your diet. Okay, probiotics. We definitely want certain probiotics in the diet. So the ones that have shown to help with respiratory infections in kids. Lactobacillus acidophilus, Bifidobacterium lactis, Bifidobacterium animalis, Bacillus subtilis. I hope I haven't butchered any of those. Basically, my recommendation for probiotics is find a good one with some good strands. Ask your holistic pediatrician which brands are decent. For young children, I like either HMF Natigen. I don't have like an affiliate link with them. I just happens to be the one I use. Same for Claire Therabiotic Infant. I'll use that one too. Can cause a little bit more gas. So if you have a gassy kid, maybe we'd go with the other. And then for older kids, I'll also use the Claire one, like the little chewables. A lot of kids has some stuff that's great. There's a bunch of good ones, but just make sure you're not just getting like, like whatever's on the shelf at whatever store because it's probably not going to be third party tested. Actually, there was like a whole thing recently about I would quote the article or wherever I heard it if I could remember. So I'm sorry if I'm totally butchering this, but what I heard was that 50% of the probiotics on the market do not have the strains in it that they say it does. So you want to get it somewhere reputable, like my full script dispensary, where you know it's third party tested, you know it's being stored correctly, and you know that there's no adulteration. So there's not stuff in it that you don't want in there. So that can happen too, where there's supplements that have stuff that you don't want in it. And then there's supplements that don't even have the thing in it that say it's in it. And then there's supplements that haven't been stored correctly, such in like those big warehouse type storage facilities that we all order our cases from. Don't order your supplements from them. Go to my full script dispensary, please. You don't want to be accidentally giving your child some crazy like arsenic or something. Omega 3s. All right. So fish or algae. So if you're, vegan, vegetarian, you can get algae-based oils if you want to support omega 3. These are really good for supporting cell linings. They're really good for immune balance, especially brains, really good for brain development. If y'all don't know, the outside of cells are coated in something called a phospholipid bilayer. That is basically fat. It has like a polar end and a nonpolar end. It can, how do I want to say this? Has one side that's hydrophilic and one side that's hydrophobic. So one side likes water, one side doesn't like water, but it's got like a lot of fat in it. Obviously, the one that doesn't like water. And so to support that kind of cell membrane, what do we need? We need the fat, and the good fat is like the omega 3. So the fish and the algae-based oils. Okay. Quercetin. We definitely want to get this plant flavonoid. So it helps with inflammation, it helps with immune support. It's also really good for allergies, which we're going to talk about in a different episode. But that is another great one to have for older kids. Ask about that one too. Okay. Herbal supports. I mean, there's just like so many things here. I feel like I should have made this episode shorter, but I think it's good information for you guys to have. So we'll just go with it. Okay. I'm going to butcher this, but it's basically umpca or V clear, but the word is Pelargonium sedoides. I can't even say it. Pelargonium sedoides. If there's someone that knows how to say that Latin word perfectly, please let me know. But the brand name is like Umca, and it's shown to help shorten like colds and flus and things like that. So if your kid has the crud and they're an older kid, you may want to use that. Just check in. Windbreaker, which is a con herb that's a traditional kind of medicine blend that can be used at like one of the first supports of illness. But you just want to make sure that you're making sure it's like, check with your pediatrician to make sure your kid doesn't have some reason they can't have it. And also know like what the age appropriate dose is, because you don't want to just be going in there with like an adult dose for like a 3-year-old, or like, heaven forbid they're on a medication that interacts and you just didn't happen to know that. Like we really just want to like personalize it. So you really need to come and see me if you're local. If you're not local and you want to do functional medicine, happy to help you with that too. But if you have a kid, just come and see me so we can like get the doses and everything dialed in, because trying to guess this on your own through like the Google chat, which by the way, ChatGPT love it for like a lot of things, but it hallucinates. So you do not want to get like your medical advice from a machine that hallucinates. That is really scary. I just found out about that. I mean, I knew it was giving me like weird, funky immune like information that I was like, this is so odd. Like I would never tell a patient to do any of this. because I was trying to figure out how to make it help me with certain tasks in my business. Anyway, long story short, like love it for a lot of things, but like don't get your medical advice from ChatGPT, just saying, because I found out that it can just make stuff up, which is like crazy. Okay, maybe everyone knows that because you guys are probably with young children, you're probably like in the know, but since I'm old, I'm just getting used to AI. Okay. All right. Herbal support, home care stuff that you can do just super easy. If your kid is like irritable, fussy, their tummy's kind of buggy, they just can't sleep, especially for kids 12 months and up. I love a chamomile tea. In fact, for 12 months and up, you can even put a little honey in it to flavor it because it's a little bit, I don't know, the taste isn't to me that amazing. Some people may love it, but I like a little flavor in it. But under 12 months, of course, don't use honey because of Clostridium bacteria. Thyme syrup, super good for coughs, super easy to make. You can just do it at home. Just get some fresh thyme, a little bit of honey, and a little bit of water. Just brew that right up, let it cool. Give teaspoons of that throughout the day. It really helps with cough and it helps with sore throats. Lemon balm, also good as a tea, helps with relaxation, all of that. Peppermint, also really, really helpful for congestion. So if you're brewing like a hot tea, just be careful that your children are old enough to be able to not injure themselves by the heat of the tea. That is something, if you're doing something hot, you just want to make sure your child is age appropriate with it. Or you could just, put a little, like a drop of peppermint oil for older children. I usually recommend doing massage under 12 months with an essential oil, but 12 months and up, you could do like 1 or 2 drops in a big diffuser of like peppermint or eucalyptus for congestion. Different recommendations on that, but that's what I've kind of landed on. Okay, Epsom salt baths. Love them. Really good for detox. Really good for soothing the system, have great amount of steam that helps with the congestion, with clearing out the coughs. You can either even kind of do that with some chamomile in the bath water or a little bit, a drop or two of lavender just for relaxation and detox. Bone broth, again, as long as there's no salt, there's no vinegar, definitely nourishing, definitely soothing. It's easy to sip, especially when kids don't feel like eating. Just make sure if you're giving your child under 12 months bone broth that you know what volume and that you're not overdoing it on, that you're not doing any salt or vinegar. Okay. All right. So, what other things can we do at home? Natural things. So, one thing that I want to talk about is homeopathy. This can be very, 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 very specific, but I want to just break it down into a couple of things that are easy to do and remember just as a parent or caregiver. For flu, okay, oscillocynum. I can't even say it. Oscillococcinum. Oscillococcinum. We should rebrand that. You guys, those of you who are making this, let's just call it flu care, okay? Flu care homeopathy, because this is a lot. Oscillococcinum. This is really good for flu season, specifically at the onset of flu symptoms. With any homeopathy, you want to do a lot of doses often when you're first sick, and then you can wean down on the number of doses throughout the illness. Okay, so that's kind of how it goes. Maybe we can do a homeopathy episode a little later because I think this otherwise is going to get outside the scope. But look for that one. If you do know how to use it, great. If you don't, reach out to your pediatrician for like the doses and all of that per age and weight. Another one I love is Cold Calm by Boiron. It comes as little liquid applicators, which I think is super nice, especially for young infants, because you don't have to worry about these pellets that most of the homeopathy comes as, which is like kind of a pain because sometimes you have to dissolve them and blah, 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 blah for young children because they can't chew those. So, that's another one I love. And then there's a bunch of like specific remedies. And this is where I feel like it can get really into the weeds unless you're just going to like go out and do a whole course on homeopathy. But Bryonia for body aches and high fever, Allium cepa for like a drippy runny nose, or Pulsatilla for like a clingy, mucusy, yucky nose. Those are others like very specific ones. I feel like that, like if you go to like one of those health food stores, like Whole Foods or Earth Fare, I feel like when I've been there before, which it has been a while that I've looked, so I don't remember if this is like current, but I feel like the little, what is that? The stand that has the color coded thing above it. I think that tells you like pretty well, like which one to get, but you always want to check with your holistic pediatrician too, just in case. Acupuncture points. Okay, well, I should actually really say acupressure because no one's going to have like acupuncture needles at home unless you're well, you may actually, if you're my friend Dr. Jen, you are an acupuncturist and traditional Chinese medicine doctor. Hello, Dr. Jen. Then you may have acupuncture needles at home. But in general, we're gonna be doing acupressure for the most of us. Okay, so, um, which ones can you do? Basically, what you're gonna do is you're gonna gently, like, massage or press these points with your thumb for about 30 to 60 seconds. So what are they? Large intestine 4 point, acupuncture point. I think it's just like LI4. It's located in the webbing between the thumb and the index finger. It supports immune activation and circulation. So just push on that point 30 seconds, 60 seconds, and that'll help with immune activation. As I'm doing it, I'm like, oh, yes, I should be doing that throughout the day. I think for winter, I'm totally going to do that. Stomach 36. This is about four finger, I can't speak. About 4 finger widths below the kneecap, and it's just to the outside of the shin bone. If you can't picture that in your head because you're driving or whatever, go home and Google it. But that is for boosting vitality and immunity. And again, that's stomach 36. Okay. Urinary bladder 2, number 2 point. That's inside the edge of the eyebrow. It's above the inner corner of the eye, and it helps to relieve sinus pressure. So really good for kids that have like forehead pain, facial pain, lots of congestion. Just go ahead and do the urinary bladder 2 point. Okay. Last one I'm going to mention because there's a lot of these. Large intestine 20 point. This is on either side of the nostrils. It really helps with congestion sinus relief. So you can definitely do that in kids that have a lot of congestion. Essential oils. Okay. So there's a lot to say on this. We need to do some like pediatric guidelines on this. But to make it simple for this episode, which is already getting really, really long, we're going to have to split into 2 for sure. Some really, really simple ones. Lavender, calming and soothing. Chamomile, it's gentle, it's anti-inflammatory, helps with fussiness, helps with relaxation. And eucalyptus is really, really good for congestion. Now, all of these need to be diluted in a carrier oil. They are very strong. We don't want to be like diffusing. Try not to get a diffuser and like walk into your baby's room and have it be blasting because that can cause a little bit of a spasm in their larynx. So we don't want that. So I always recommend like at least up until 9 months, just do massage with a carrier oil. So 2 drops and 2 ounces of a carrier oil and do massage. Older than 9 months, we can chat. 12 months and old, you're pretty safe as long as you keep it chill. You know, you don't want to be like, blasting aromatherapy so that you like, again, you can't breathe and your eyes are burning. Like that's too much. This is like 1 drop in a big thing of a humidifier. Okay, so I am realizing we're going to need to do a whole aromatherapy episode, but I think that's enough for this episode. So final thoughts, you guys. Okay, so conventional pediatrics, kind of wait and see, some supportive care, and the warning signs, which we still use in holistic medicine. Obviously, if there's an emergency, we want to seek emergency care. But in integrative medicine, we take a different, we're supporting those foundational things. We're supporting stress reduction. We're supporting nutrition. We're supporting mind body, if that's your thing. We're supporting rest, all of that stuff. And then we're adding on other things on top of that, like homeopathy, like botanicals, like essential oils, when appropriate. And it's all safe and supportive. Why not do it? It's great. Your child's immune system will be boosted, antioxidants, all the good stuff. I highly recommend it. It does not mean that your child will never, ever, ever get sick, but it does mean that they may recover more smoothly, more quickly, with fewer complications and all of that. So just remember, focus on those basics: sleep, hydration, our circadian rhythm, stress reduction. Make sure you're doing those optional supports like vitamin D, probiotics, herbs, if that feels right for you, the appropriate age for your child. And know when to call your pediatrician, which if you missed that, go back and listen because it's really important. And then you'll find more details all about it in this week's blog, this week's newsletter, and I'll be sharing like lunchbox tips and all of that. So if you are not signed up to my newsletter, definitely get it because it's actually, I don't know, I think it's really good, but I might be tooting my own horn because I make it. But I actually think it's really helpful. I write them all myself. I don't have like a team writing my newsletter. So I really do try to give you things that are good values. So sign up for that. It's on my website, middlepathintegratedpediatrics.com. I'll try to put together an immune support shopping list if I haven't already in this week's newsletter. And also, you guys do not forget my Nourish with Confidence course, which goes deeper into infant nutrition and supplements ages 0 to 12 months. There's like the 0 to 6 month one, the 6 month to 12 month one, or you can get both. And if you're a member of the family at Middle Path Integrative Peds, you get it for free. So if you want to become a member and get that as well, I would love to see you. Sign up for a meet and greet today on my website. And thanks for tuning in. So just remember, y'all who don't come to my practice and cannot reach out to me, the podcast is for education only. Really do not substitute this for personalized medical advice. You just need to know when to contact your child's health care provider, get the correct doses, find a holistic pediatrician, and all of that. And I hope this was helpful. I'm wishing you well. And come find me at Middle Path Integrative Pediatrics. Again, if you don't know me, I'm Dr. Ellie, and I'm a holistic pediatrician, and I see kids 0 to 21 for holistic pediatrics and kids 2 years to 102 for functional medicine. All right, wishing you well, and look out for next week's episode, which I think is going to be part 2 of this because we'll have to split it into 2. If not, maybe I'm going to do fall allergies, but we'll see. All right, bye guys, wishing you well.